Hello, friend, and welcome back to the episode. Now, I know that the hardest part of the dental hygienist to myofunctional therapist transition is not the clinical knowledge. I know that might surprise you. It's not, it's the conversation. Now, many of you guys, you finish your training, you know the material, but you have no idea how to start a conversation with a potential client without feeling like you're about to be found out, without feeling like you have some dirty little secret. And the more that you wait to feel ready to have those conversations, the fewer conversations that you have, and the fewer people ever find out that you can help them. I know that this is a huge problem. And so in this episode, you are going to understand why the transition from dental hygienist to myofunctional therapist stalls out, what's actually in the way, and the one shift that changes how you show up in every conversation from here on out. So let's get into it. So first, the thing that gets in the way, and nobody really thinks about this, nobody names it. It is not the clinical knowledge. It is conversation, okay? Getting clients, my friend, is a numbers game. And the numbers matter when it comes to actually growing your business. But the number that matters is conversations. The more conversations that you have with potential clients, the more opportunities that you're going to create to present what you know, to show them, to wow them with your knowledge, and offer to help them. Remember, I tell you all the time, the most important words that you can say to somebody are, I can help you, okay? Now, many of you guys, I know that you are waiting on conversations. Period. You're just not even having them. When I ask my own coaching clients about the number of conversations they're having, many of them, when we start working together, are having none. And it's really fun because by the time we've had, maybe 2 or 3 months of coaching, when we meet, the first thing that I ask them, what's working, what's not working, and what do you need to do differently next month? Thankfully, one of the first things that they start reporting to me when we talk about, hey, what's working is I'm having conversations. I'm having conversations, okay? Now, the goal of that conversation, my friend, is not to sell therapy. The goal is to move that person towards a free assessment, okay? That is where you get to shine because once somebody is sitting in front of you, they've submitted their paperwork, you have some information about them, and you're talking one-on-one, you have their undivided attention, you get to show them your knowledge, okay? This is not a sale. This is not selling. This is education. And what kills the conversation before it even gets started for many of you guys is awkwardness, okay? And the awkwardness comes from several different things. One, well, I would say the biggest one, let's just get that out of the way. If you're not confident in your clinical skills, okay, that's a no-brainer. You're going to have a hard time talking about it. But beyond that, where a lot of the awkwardness comes from is when you don't have your systems in order. Somebody asks you how to work with you, how to schedule with you, and you don't have any of those answers, okay? If you've been with me for any amount of time, you've heard me talk about butt in business chair hours. The reason you set those right at the very beginning is so that you know when you're talking to somebody at a wedding or at a barbecue, you can tell them, yeah, I currently see clients, from 9 to 6 on Fridays or whatever. So not having systems, not knowing when you're going to work with somebody, not having your hours set, your prices. Now, prices is something that I don't always, I don't specifically give a number. And here's a couple reasons why. Bear with me. I know this is a shiny squirrel moment. The reason I don't specifically give somebody a number is because I have been burned, okay? I know my prices. I have no problem saying my price is $5,000 for a year to work with me. However, I have a 6-month program. I have a 12-month program. Okay. I have been burned by telling somebody, oh, yeah, sounds like you're just a run of the mill case. You're probably going to be pretty easy. You would be just a 6-month program, would be $3,600. Okay. And then they get in front of me for an exam. They've got diagnosed sleep apnea. They've got every symptom under the sun. They're a complicated human as it is. And it's hard to change your mind once you've said, oh yeah, your price would be $3,600. And now you're saying, I will not touch you with a 10-foot pole unless you're a comprehensive client. So that's one of them. The other thing is I also have an associate. So my associate's prices are a little bit less expensive than mine. And if somebody wants to work with her, versus me, so I don't typically get into the nitty gritty of prices, but I will tell them, that there's a range. Okay. So that's the first thing. Okay. It's not your clinical knowledge. It's not having the conversation. Now, the one shift that changes how you show up in every conversation is your belief. Okay. So belief is the foundation. It's the belief in your skills, your solution, your people, your prices. The belief is something that has to show up first. So oftentimes I'm telling my clients, hey, belief before bank. You have to believe in your skills. You have to believe in the solution that you bring to the table, the transformation that you offer people. You have got to believe that when it's easy, when it's hard, all of the time before money is ever going to show up in your bank account. So that belief shift is the first thing that changes how you show up in a conversation, okay? And along that same note is belief in your prices, because I have said this to you before, you are a mirror to your client. She's going to feel your energy. So if you do not feel confident in your prices, if you have not figured out, as I call it, your happy pricing, which is that price that's above your resentment level, but below your, oh, I'm going to barf when I say this out loud level, that's your happy price. If you don't feel good about that, if you don't believe in the value there, then the energy that you're going to give off when you say it is going to be palpable. Okay. Now, some of you guys think you're being sneaky. And with love, I'm going to tell this story because I had a coaching client recently who set up her programs, and for children, she had a 6-month and a 12-month. And she, when we talked about the 6-month child program, I said, I don't think as a clinician, I don't think that you can get good results for kids in 6 months. I have sold one 6-month kids program in my, almost decade of being in business. And that girl was like a 4.22 GPA, 17-year-old. She was an ROTC cadet. I mean, I'm telling you, she had her poop in a group. Okay. So what was underlying this, and I knew exactly what my client was doing here, is she didn't have belief in her full year price. And I knew that she was just scared and didn't believe in herself and her process and the transformation that she brought to the table. She didn't believe in her prices. And I told her, I know exactly what you're doing here. You're going to sell this cheap program because you're too chicken to sell the expensive one. And she was like, well, of course, that's what I'm going to do. So even though she didn't want to call it that, that's what it was. She didn't believe in her prices. So let's talk about the transition from dental hygienist to myofunctional therapist. And I'm going to just tell you in my experience, okay? So first of all, just to give you a little bit of context, remember how desperate I was to leave dental hygiene. So while I hate the phrase, fake it until you make it, friend, I was faking it all the way to the bank. And I don't mean in a negative way. I don't mean like I was harming anybody or anything like that, okay? I didn't have the confidence. I didn't have the authority in the field, so I was just rolling with it. But the one thing that I did, and the one thing that I did right, which is why we're having this conversation, is I talked and I talked and I talked and I talked. Okay? That is how I became so well polished. I have coached many of you guys just simply alone on having conversations. I used to have a program called Conversations That Convert. And that awkwardness that I talked about earlier, people feel it. I know beyond a shadow of a doubt that you have been in a situation where somebody was awkward and you were just like, okay, no, thank you. So I practiced on everybody. You have a captive audience in your chair. If you're still doing clinical hygiene, you might have 8 to 12 humans in your chair every day. I talked to children. I loved children because I could talk to them and they had no idea what I was talking about. And I also could get in their mouth and look around. So I got to practice. But I talked and I talked and I talked. Every single person got a conversation, okay? Because you're dangling that carrot. You are trying to get them to a free assessment. And the reason that I say that is because in your free assessment, that's where you get to shine. You're not going to shine and sell your expertise and your knowledge when somebody's in the dental chair. It's just not going to happen. Very rarely. Okay, I'm not going to say it's not going to happen. But that is not you in your best sales element, if you will. It's not you in your best knowledgeable, like, hey, let me show you everything that I know. Because first of all, you don't have their paperwork. You don't know anything about them. And you're also trying to do your dental hygiene job, right? So you're just kind of half-assing it through there. But if you get somebody to a free assessment, you get to have an undistracted, focused conversation. Okay. So dangle that carrot. Everything you're doing, you're just trying to get them to the free assessment. And that leads me to don't do your paid work for free. So you're going to be getting them to a free assessment if you offer that. If you're new, I think you should, because it's a numbers game. That's how you get people on your calendar. But you're going to move them from a free assessment to the comprehensive exam. And I think that is really easy. I had like 80% conversion rate because people would meet me at that free assessment and I was so knowledgeable. And of course, they love my personality and, you're just warm and welcoming and we just have big caregivers' hearts. And you educate them and they can see why it makes sense for them to have an exam. But getting them to that free assessment, it's kind of like they have to commit, they have to show up. So what I mean by don't do your paid work for free is you're just kind of dangling that carrot to talk with them to get them to the assessment. Don't give them the whole kit and caboodle there. And certainly don't perform the components of an exam there because you want to get them on a call. That is the biggest thing. When I coach, I'm constantly telling my students, get them on a call. Get them on a call. Now, with that said, if they, like I had some people back in the beginning of my business, I was willing to give out free therapy or very, very cheap therapy to just get the experience. And I remember one gal who would just like email me, back and forth. And I would be like, those are great questions. Let's hop on a call and we'll talk about it. Well, and then she would say, well, I don't have time for a call. Well, that told me, why am I going to waste my time? Why am I going to give you bargain therapy or free therapy when you can't even make the time for a call? Okay. So that's kind of where I would always draw the line. I want to get you on a call and I'm not going to answer emails back and forth. I'm also not going to give away my paid work for free. So once you get somebody on a call, you're having conversations, lots of conversations to get them on the call. Then how you educate people, your robust knowledge, your confidence that comes from having all of those conversations, that's going to shine through. I always tell people, I haven't sold a dang thing in a decade. I simply offer, hey, you have a problem. I have a solution. You're here because you raised your hand saying, hey, I need help with this. Nobody ever shows up on my calendar without a reason for being there, right? And especially because I don't do free assessments. So they pay money to be there. And I'm just telling them, hey, I can help you. Much the same as if somebody goes to the dentist office and they have a toothache, the dentist isn't going to beat around the bush. He's going to say, hey, you have a cracked tooth. I can help you with that. Or you have an abscess. I can help you with that. So you're helping people, you're educating them, you're just meeting them where they're at. And they said, I need some help. Okay. So the best thing that you can do is start having conversations. So how do you do that? A couple different ways. My favorite way to start having a conversation was during my oral cancer screening, because you're in the mouth, you're looking around. It was a great opportunity for me to assess for a tongue tie or partially assess. And then I would say to them, hey, you probably noticed that I was doing something different or something additional. Did they notice that? I don't know. I don't care. It was the opportunity for me to just get in there and have this conversation. And I would say, hey, you might have noticed I was doing something additional. I'm taking some advanced training in myofunctional therapy. You probably have no idea what that is, but I was screening you for, I was looking at the size of your airway. I was screening you for a tongue tie. Do you know what a tongue tie is? That kind of starts the conversation. So that is how I did it. Now, I have had some students in the past who will just like take a sticky note and they'll just have a topic, like one certain topic that they're kind of just practicing on for that week. And anytime they have that opportunity to get into that conversation or that topic, they take it. Now, I also have seen that be extremely awkward. So that's the thing. You have to talk. You have to talk. You have to talk. Having conversations is what's going to help you get polished. You're going to get more confident, because the one thing that is in your way is that imposter syndrome and not having conversations. So start having them. I mean, I've had students who literally like keep a hashtag. Hey, I have a goal to have 10 conversations today. Or, if you're going to only see 8 patients in a day, I have a goal to have 8 conversations. I have shared this story before, but years and years ago, right when I was starting out, I had kind of basically a man who was like the poster child for sleep apnea, middle-aged, overweight, big waist, big neck, and he was in my chair and he was just heavy breathing. And I was exhausted. I had talked to people all day. I was tired. I just wanted to clean teeth. I didn't want to talk, but I did, because I had a goal and I talked to everybody. And I asked him, I said, hey, do you have sleep apnea? And he was like, actually, I do. Why? How do you know? So I talked with him back and forth, and he owned a sleep study lab and a sleep study company in Colorado. And that changed drastically. That connection with him drastically changed the course of my business. So had I not been having that conversation, he wouldn't have known. Okay. Also, I had a conversation once with, I would say maybe like somebody about 13 or 14. Just practicing. I mean, who talks to a 13 or 14-year-old about snoring? This girl does, because I was practicing. And then a few days later, I got a phone call into the office, and it was her dad. And she went home and told her dad, hey, snoring is bad, and here's why. And so she told him everything that we talked about, and she had him call me, and he did an exam, and he got therapy and all of that stuff. So you never know. But having conversations, very important, okay? It's a numbers game. If you want to convert people to paying customers, you have to start having a conversation, because the truth of the matter is they're rarely going to just be like, yeah, let me pay for therapy, okay? You have to wow them. You have to educate them. You have to make that connection, which is one of the reasons why I think it's hard for people who just sell a package, that might include an exam, because you're asking somebody to make a big investment, both time and money, with you, and they may not even be able to stand you. And they also might not even feel comfortable with your level of expertise. So think about yourself as a consumer. I would never do that. I would never commit to something with somebody if I haven't kind of had a trial run with them. So, my friend, the secret is talk. Okay. Talk, 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 talk. I want you to talk so much that you are exhausted by the end of the day. All right, let's land this plane. So if you are listening to this, first of all, if you're listening to this and you're not trained, good for you, because you just got a very valuable piece of knowledge. If you're listening to this and you're considering, transitioning from dental hygiene into myofunctional therapy, you needed this conversation. You also need your clinical training. And I just happen to have that for you. Learn myofunctional therapy in 60 days or less. It's the fastest way I know for you to get your clinical knowledge so you can start building that life first business, because that's what we're all about here, is building a life you're bonkers about. And if you are listening to this, my friend, and I am speaking directly to you and you are trained but stuck, that ends here. You've done the clinical training, you know the exercises, the anatomy, the assessment, all of that stuff. Okay. What you don't know is who you sell to, what to charge, how somebody's going to find you in the first place. Okay. That gap, you do not close that gap by sticking your head in the sand or just throwing all the spaghetti at the wall. Okay. It closes when you develop your CEO skills. And I'm the girl to help you. So what I want to tell you is, if this is you and you're thinking about joining the Profitable Myofunctional Therapist, you want to book your Get Unstuck call now, because I know that my calendar is going to get packed, because I'm so excited at the end of August when we open the cart and launch our fall cohort of the program. That's going to be the first time that I'm teaching it live with you guys. And just so you know, I will be a month out of my AI certification, and it is going to be amazing. So at that workshop, you're going to bring your laptop or your computer. You're going to get your Claude account all set up, and you are going to leave with your who. You're going to leave with your offer. You're going to leave with your pathway, your visibility, all of that stuff started. Okay, friends, we are not taking notes. We are working. So I'm going to teach that workshop live. So it's not webinar where we can't interact. It's going to be live. So, and we will open the enrollment right after that. So if you have questions, or you're trying to figure out where to start, or if you're not trained and you want to start with LMT 60 so that you can get into that cohort, now is the time. Okay. So wherever you're listening, watching, reading this, we'll make sure that you have the link to get your Unstuck call completed, because things are about to get exciting around here. That is a wrap, my friend. Okay. Get out there, start having conversations. I know it's scary. I know your pits are going to get sweaty. The only way through, or the only way to the other side of the discomfort, is through. Okay. So as my business coach, Olivia, says, gag and go, my friend, because you got to do it. So that's a wrap. I will be back soon where we will talk about all things building, simplifying, and growing your myofunctional therapy business. I'll see you then.